I am so excited to be here. Today, we're going to talk about the link between nutrition and substance abuse. I'm going to cover one of the papers we recently published in Public Health Nutrition called Staff Perceived Barriers to Nutrition Intervention in Substance Use Disorder Treatment. My name is David Wiss. I am a registered dietitian and the founder of Nutrition and Recovery. I'm a fifth-year PhD candidate at UCLA in the School of Public Health. And Nutrition and Recovery is a group practice in West Los Angeles. We see people all over. I'm active on social media. We also have a new blog called Wise Mind Nutrition, where we are talking about all things nutrition and mental health. I don't have any financial conflicts of interest. However, I will say that I have a strong bias toward the link between nutrition and mental health. It is the lens by which I see nutrition, and I do think that it is the future. So here's the paper we're going to discuss today. This was work that I did in Santa Cruz at a publicly funded treatment center. There was some funding to establish a better nutrition program, and we brought in some experts and did some data collection. So as most people know, there is ongoing crises with drugs and substances in general. It's a chronic relapsing condition. We have an urgent need for new approaches that improve delivery of treatment and enhance client self-management. We know that with respect to organizational change, programs that have the most reluctance to change are often the ones that would benefit the most. So we've learned that, we need champions for change. We need people within organizations that can really help facilitate new modes of treatment. And we need facilities that are champions in the industry, being willing to take on new challenges and incorporate new data. In 2014, a textbook was published. One of my mentors, Dr. Timothy Brewerton, was a editor. And this was, some early efforts where we talked about nutrition for drug addiction. So in 2014, we reviewed all the available evidence at that time, and were able to make some recommendations for different substances, looking at differences, for example, between alcohol, stimulants, opioids, etc. There's a lot of really good material in this textbook. A couple of years later, there was an updated textbook where I contributed a chapter about the role of nutrition. There was some new data within those few years, particularly focused on the gut. So one of the main focus areas for nutrition interventions is on gut health. We know that the gut and the brain communicate bidirectionally. When we think about nutrition for mental health, we really are thinking about the gut as being the first interface for the food that we eat. Obviously, the first interface is the mouth. And then, there's a whole host of biological processes that link the gut and the brain bidirectionally that I won't get into today. But in a nutshell, when we change the way we eat, we can change our mental health. And that is super important for people in early recovery from drugs and alcohol. So part of those efforts were just to recommend overall things that people in recovery can do, looking at drinking more water, having more plant proteins, more fiber from whole grains, thinking about ways to fight inflammation through diet with food rather than supplements. There's a lot of supplemental interventions that are out there, and I promote those. However, I think there's a really good opportunity to get people learning how to cook food, how to prepare food, and how to feed themselves and do life skills training, learning how to go to the grocery store and clean up afterwards. These are a big part of the overall picture of nutrition for addiction recovery. So yes, getting people to eat on a schedule, getting people to eat fruits or vegetables at every meal, and thinking about things like caffeine, as well as minimizing exposure to artificial sweeteners. Shortly thereafter, we published a paper in the Journal of Academy of Nutrition and Dietetics, which really proposed group topics for these settings. So we've established that there's a need for nutrition in addiction treatment. We've published some guidelines that suggest things that people can do broadly as well as specifically for substances. By the way, that chapter included some recommendations for each substance, but I just didn't go into that level of detail here. We then proposed group topics. I think a lot of treatment centers want to incorporate nutrition, but they aren't able to substantiate using a registered dietitian for one-on-one. So we've developed curriculum that can be used in these settings, teaching topics like sugar, salt, fat, the different ways food groups are classified, eating for mental health, anti-inflammatory eating, emotional eating, cravings, definitely focus a lot on the gut and the gut microbiome, the importance of fiber. We talk about cross addiction with caffeine and nicotine. We help people sort through fads and myths and talk about body image and eating disorders, as well as disordered eating. Exercise and recovery, something that some people don't do enough of, and even something that some people do too much of. And of course, budgeting, shopping, cooking, hands-on nutrition. And then after that, we did a quick survey in Los Angeles. We used the Substance Abuse and Mental Health Services Administration treatment locator to identify treatment centers that were in the local area. And we just did a quick rapid assessment, a phone interview where we called them and asked them if they offered any nutrition services on site. And we found that out of the 128 facilities that met our criteria, less than a third offered any nutrition services. And of that less than third, most of them did not use registered dietitian nutritionists. So overall, the statistics suggest that less than 7% of substance abuse treatment facilities, and this was in Los Angeles, utilize registered dietitians. So some utilize other nutritionists or even substance abuse counselors to facilitate the psychoeducation. And this really just documented how underserved the topic of nutrition is in these settings. And then I did a paper on the opioid crises, which really looked at the broad crises in the context of overprescribing, the environmental factors. But I really tried to focus this paper on gastrointestinal health. So most people know that there's a lot more data linking the gut and the brain, as I've mentioned. And so there's been this great kind of question: how does, opioids fit into this sort of picture? There's been a few animal studies that show rats and mice using morphine and other opiates have changes in their microbiome. So it starts to pose this question: can we actually measure changes that result from drug use? And can we think about using nutrition to improve that gut environment? So this is just a very involved, overarching conceptual model. There's a lot going on here, and I'm not going to even attempt to break it down. But we look at the cycle of addiction, whether it be alcohol, drugs, caffeine, nicotine, and how it can create reward, preoccupation, and craving. And then just putting that in the broader context of the environment where people live, which is influenced by socioeconomic status. And of course, thinking about brain reward, genetic factors, and how all of these things can be impacted by stress, trauma, adversity, especially in the first 18 years. Thinking about how some of that can change genetic expression, change the microbiome. So there's a lot of pathways here, many of which are testable and require much more work. But the point is that even in a big model, a big biopsychosocial overview where we're thinking about generational legacies and trauma and drug addiction, there's room for nutrition. There's room for food-based interventions to improve mental health. And then another recent papers of ours in the Public Health Nutrition Journal was titled "Food Insecurity Partially Mediates the Association Between Drug Use and Depressive Symptoms Among Men Who Have Sex with Men in Los Angeles, California." So this was the cohort in which I did my doctoral dissertation at UCLA. We have found that there is a link between drug use and depressive symptoms. That's pretty well established. But in this particular study, we showed that food insecurity might be involved. So it sort of started to ask certain questions like, what happens when individuals spend their money on drugs instead of on food? Does chronic malnourishment lead to depression? So we didn't specifically answer those questions in this study, But these are things to think about for future research. And this was the model that showed food insecurity mediated 15% of the relationship between drug use and depressive symptoms. So we're starting to get closer to really developing nutrition interventions for substance use disorder treatment. And, before we do actual interventions, it's really important to think about the staff. And when we think about organizational change, we need the staff to be role models. We need the staff to be involved. Otherwise, the funding and the efforts don't really work so well. So this is an overarching logic model of the efforts we did in Santa Cruz, reviewing and updating the nutrition criteria, assessing the foods and beverages that were offered, looking at the barriers to improving the food service operation, and starting to collaborate. Building these, team-wide meetings is not easy when you got to bring in food service staff, clinical staff, but we were able to do some really important work and, work with the medical team. And, we were really aiming to observe what was going on in their current, food environment, and thinking about ways that we can not only improve the food environment, but also bring in group education. Okay. So we developed some guidelines for nutrition in the food service operation, and we trained staff about the importance of nutrition in addiction recovery as well as mental health, and got some staff members to be responsible for championing some of this change, starting to run some groups at this facility at the same time that we changed the food so that the actual lessons matched the changes. So for example, if we moved away from refined grains and into more whole grains, we would want psychoeducation groups to discuss why that's important. And again, focusing on why that's important for recovery, why that's important for mental health, rather than for cardiovascular disease or for weight-related issues. And so this conversation around nutrition for mental health is really, really getting some attention now. There was an article in the New York Times a couple of days ago, and I think, we have impetus to state that, more data is needed, and that there can be some potentially life-saving interventions. Okay. So our goal, the outcomes, were to increase the satisfaction of, the food and the beverages, improve people's quote unquote relationship to food, and make a shift in the staff's beliefs about nutrition in recovery. Okay. With the long-term goals of improving quality of life and decreasing morbidity and mortality. So this started in March 2019. We did some staff training, came back a few months later, more training, more implementation, and then we collected data at the end of 2019. This just shows that there was a bunch of different sites that we collected data from. So this was a large treatment center. They had, an outpatient facility, residential, et cetera. There were some differences in the data that we collected across these sites before and after. And I just include this to highlight that we weren't looking at individual level change in staff members. We were looking at organizational change, right? So actually looking at how we can create a culture of inclusion around this topic for nutrition. And this is our primary data. We did some surveys at baseline, and then some education, some training. And we found that after implementing the full program, the staff members were more comfortable. They reported less barriers to change with respect to correcting nutritional deficiencies, implementing nutritional change during detox, proper monitoring of dietary supplements, and budgeting for new healthful menu items and implementing new foods. So our data suggests that the implementation of these changes can be done, and that the staff is a super important part of it. This was the first study to describe nutrition changes in a large nonprofit SUD treatment center. Despite known barriers to organizational change in these settings, nutrition interventions can be implemented, and we have provided evidence that some of these barriers can decrease following organizational change, specifically barriers related to providing nutrition-related treatment, collaborating, and menu changes, as well as client satisfaction, all decreased following the wellness initiative. And our description of staff concerns and attitudes, which you can see here, toward provision of novel nutrition interventions may inform future efforts to improve food service environments and to teach nutrition classes in these settings. So yeah, people believed that this might have been a waste of time and resources beforehand, but afterwards we were able to show that staff was on board. And I'm telling you, if there's anything that matters, it is the culture of the organization, the health of the organization, and the staff members. So we got people excited about this, and that trickles down to the clients and to the patients, which spills out into their families and to the community as a whole. So what can a dietitian do in treatment? I've proposed that every patient who walks into addiction treatment should be assessed by a behavioral health dietitian. I know that that's not always going to be feasible economically. But in those cases, we would screen for eating disorders, other disordered food behaviors, potentially look at some of the nutrition-related labs, certainly run groups and do individual counseling, collecting data, publishing the findings, developing new curriculum, taking people on experiential therapies like going to the supermarket, attending treatment planning, really being integrated, having the RD be integrated into the mental health team, working with the therapist, doctors to help achieve treatment goals, building in nutrition and exercise interventions to facilitate behavior change, and then of course, auditing the menu, suggesting substitutions that are within the budget as a way to improve the food environment. There's a lot of areas where we need more information about how quickly we can make some of these changes in terms of increasing fiber. Certainly there's data needed about antioxidant supplements. What do we do about leaky gut and intestinal permeability? How do we create better immune support? Which probiotic strains are best? If we should be doing stool testing, magnesium, genetic testing, amino acid therapies have gotten pretty popular if they're safe. What do we do when there's an eating disorder and a substance use disorder? When do we refer out? When do we, treat them concurrently? How to address body image concerns, how to reduce night eating, how we can implement mindful eating or soulful eating, we sometimes call it. And, if some of these long-term nutrition therapy interventions can improve an individual's hormones and affect reward processing, executive functioning, and certainly the long-term nutritional implications of many of the medications, how to best talk to people about it, best topics for group education, best practices for implementing cooking classes and other life skills workshops, and implementing these guidelines in a wide range of settings, thinking about caffeine, nicotine, smoking, vaping, encouraging reduction or cessation of some of these things, best strategies for incorporating exercise, and the best way to collect data and to publish findings. So this is an area that's ripe for researchers and interventionists. I think it's safe to say that nutrition for addiction recovery needs a lot more support. And if anyone's interested in collaborating or continuing the discussion, you can see my contact information here. That's my email. Please follow on social media and check out the new blog at wisemindnutrition.com. Thank you.